much. My name is Dr. Amy Newberry, and I'm a pelvic floor therapist in downtown Wilmington. So basically, like, what does that even mean? I help people with like peeing problems, pooping problems, and sex problems. So all the things down here that nobody like really wants to talk about, right? So we're here to talk about it today, and there's nothing that is TMI. Clearly, I was literally in a vagina costume, so. But yeah, so thank y'all for being here. So we're gonna start with a couple of questions. I'm just gonna ask you guys some questions to figure out like where you guys are at in your pelvic floor journey, okay? So raise your hand if you've ever had a baby. Okay, got all of that never happens. So kudos to you guys because you're being super proactive in your pelvic health, which is very important because a lot of times we in the US are doing a lot of reactive care. So once something's wrong, we're like, oh crap, let me go get help for this. But if you're kind of ahead of the game, then you're taking care of yourself, which is maybe why you're here. This is a health and wellness event. So give yourself a pat on the back. Okay. or your neighbor. Okay. Does anyone struggle with like issues with like feeling like you have to pee all the time, you have to go to the bathroom a lot, or like you feel like you can't hold your pee in and you're constantly running to the bathroom?
When I drink beer.
When you drink what?
Beer.
Yeah, beer. Alcohol is a bladder. Yes. Yeah. So beer is a bladder irritant, so it can cause you to like pee a lot more frequently. And there's also like a lot of other bladder irritants, but alcohol is one of them. Does anyone struggle with constipation? Okay, don't go super regularly. No. Okay, got a couple people. Me too sometimes. Cool. Okay. Does anyone struggle or has anyone ever experienced like pain with intercourse ever? Even just once? Yeah. Yep. So, me too. So, we're also here today to just kind of be open and honest. This is an honest conversation. Nothing's TMI. The reality of pelvic floor stuff is that 1 in 4 women are actually affected by pelvic floor dysfunction, and all the things I just listed that we've kind of talked through is pelvic floor dysfunction. So, and I suspect that 1 in 4 is actually severely like underdiagnosed because like who talks about this stuff? Like not in sex ed, not maybe with our friends, maybe, but not even sometimes, and not with our doctors, like don't always talk about it. So we're here to talk about it. Okay. So we're here to break the stigma and the taboo surrounding the vag, because we're in a vag policy now, and anyone is welcome. I'll take this off at the end of the talk, and you're welcome to try it on. Okay. But this part of our body it's a very like misunderstood, misinformed area. Like there's a lot of myths around it too. So raise your hand if you've ever heard. Well, does anyone have leakage? Because you can have leakage without having a baby. Yeah.
Sometimes during, oh my god, I'm blanking. This exercise.
Jumping jacks. Yeah.
And it's normalized. I feel like it's so normalized, and just like recently, I'm like, this isn't normal.
Yeah, exactly. Jumping jacks. Any other things?
Like running.
Mm-hmm. Yeah. So all of those things, like you don't have to have had a baby to struggle with leakage, and we'll talk about why that's the case in a second. But that's why I want to talk about leakage, because raise your hand if you've ever been told, oh, well, you just said it, leakage, that's normal, right? Have you guys ever heard pain with sex? Just have a glass of wine, try to relax.
What?
Yeah. I'm not kidding. Like these are literally things that my patients like tell me that people have told them.
Oh my
I heard
doctors. I didn't want to say doctors, but yes. Or like OBGYNs have told my patients this. So not okay. Also, have you ever heard like just deal with it? Like, a lot of postpartum moms will get that too. Like, just deal with it. That's normal. So if any of you guys are thinking about having kids in the future, think about if someone ever tells you that in the future, just know that that's not normal and you don't have to just deal with it, okay? That's one of the main things I want you guys to take away from today is leaving here and being like, okay, those things are not normal and those are things that, yeah, red flag. Red flag. Have you guys seen that TikTok or Instagram? It's like red flag. Red flag. That's what that reminds me of. Okay, so your frustration with painful intercourse, frustration and embarrassment surrounding like leakage, all of those things are treatable with pelvic floor therapy. So it's not just deal with it, wear black pants, wear a pad, like you can get treatment for it. Just like, you know, if you injured your shoulder or your back or your knee, like they would send you to a physical therapist, right? So if you injure your vag, you should probably go to a physical therapist for that too. Okay. So 3 takeaways. We're gonna get moving a little bit, okay? I know the space is a little small, but I'm gonna have you guys stand up a second, okay? Oh, can you grab me my Polly the pelvis? Thanks. That's my boyfriend.
I need Polly.
Yeah. Okay, guys. I know I'm in this costume, but I'm gonna put my hands on my hips. So we are gonna, number 1, find your pelvic floor. Okay. So everyone put their hands on their hip bones. Feel that. So you're gonna walk your hands down your groin all the way to the center, and you're gonna find a bone there too. Yeah. So
Wait, where?
okay, here we go. Okay, so you're on your hip bone, and then you walk your hands down, and then you'll hit a bone right here.
Oh, okay.
Oh, thanks. This is Polly. That's funny. Yeah, we can have it here too. Okay, so. Okay.
Yeah.
So right now, when you guys are out here, you're touching these 2 bones, and now in the center, you are touching right here. Yeah. So this is your pubic bone. That's what you're touching. Now, if you turn around the back side, you have your spine here, which you can feel, and then at the very end of your spine, you can feel your tailbone right between the cheeks. Right here. Everyone find their tailbone?
Yes.
Okay, good. Now, the last bone we're going to find is your sit bone. So your sit bone is here and here. And you have to kind of put a little more pressure. get to that sit bone. It's on both sides.
Stuff on top.
Too much. Did everyone find it?
No.
Raise your hand if you didn't find it.
The sit bones?
The sit bones? Okay. So just kind of like Okay. Good. So the reason why you need to know where those bones are is because your pelvic floor attaches to those 4 points. The sit bones, the pubic bone, and the tailbone. So what that means is your pelvic floor is a hammock at the base of your pelvis. So everyone, take your hand. And you're gonna put it right here. Yeah. And so this is your pelvic floor. Okay. You have officially touched your pelvic floor. Okay. Now that you've felt your pelvic floor, the next thing that I want you to do is, well, before we do the next thing, sorry, but keep standing. These muscles help control pee, control poop, and also be able to, have sex without pain. So think about so everyone hold up their bicep, their muscle, their arm. So try to open up your arm like this, and then close it like this. So your bicep muscle is the muscle that is running from here to here, and every time you do like this, you are contracting your bicep. You can feel the muscle get tight, and if you let it go, it relaxes. So your pelvic floor has to be able to do the same thing because it's muscle tissue. It's nothing different. It's still muscle. So the problem is that people end up not using their pelvic floor like this because they end up just being like this and keep it tense. And when it's tense, like, I mean, sex is gonna hurt, peeing's gonna be a little bit uncomfortable, you might have to pee a lot because the muscles are like tense and not letting go, okay? So the next exercise, guys. So, okay, we already found our pelvic floor. You know where it is, you know what it does. It helps you keep in pee and poop when you don't want it to leak out. It helps you to empty when you do want to go to the bathroom on the toilet. And then it also helps you be able to have sex without pain if it's working correctly. And then also if you're prepping for like birth or delivery or postpartum, it helps to like be able to get out of the way so that your baby can come through the birth canal. Okay? Because people are like, well, I'm gonna do a lot of kegels. Have you guys ever heard anyone say, just do your kegels?
And they still say that, so
I know! Oh my gosh, it's wild because like it actually can make some problems worse if you just do kegels. Because if your muscles are already like this, and then what if my bicep was stuck and I'm like, well, I'm gonna go to the gym and I'm gonna do some more curls. And then all I'm doing is like contracting an already tight muscle. So that's what kegels are doing to your pelvic floor, and it can actually cause more problems in the long run if you don't lengthen your pelvic floor first.
How do you lengthen your
Yeah.
pelvic floor?
Jess, I love that. That wasn't a planted question. That's like literally what we're about to talk about next. Okay, so we're talking about lengthening your pelvic floor because 99% of my patients have pelvic floors that are overactive. So put your hand on your chest and your hand on your belly, and then take some really big, like the deepest breaths you can take. Good. Do like a couple. Keep going. I'm gonna watch you guys. Okay. I'm gonna pick someone to come up here. Maggie, do you want to come up?
I knew that. You're back there. I was on your side.
Yeah, you're right in the center. Okay, so put your hand on your chest and your hand on your stomach again. And then stand sideways facing me. Facing you. Mm-hmm. Okay, so take some deep breaths again, as big as you can. Good. Okay, everyone, do you kind of see what's happening at her top hand? Like, which hand is moving more?
The top.
Yeah, and then on you guys, which hand did you feel moving more?
Bottom.
Okay, I got one bottom, got a top, bottom. Okay, a little mixed. Okay, so what you want to do is you want the bottom hand to move more. So all my bottom hand people, good job. That's good. So anyone with the top hand moving, try to breathe, when you breathe in, try to get the bottom hand to move more. Can you try to switch it? Try to keep the chest really still. It takes a little practice. It feels really weird. Yeah,
It's like belly breathing, right?
belly breathing, diaphragm breathing.
Yeah.
So this is called diaphragm breathing, and the reason why you want to be able to diaphragm breathe is because it actually helps relax your pelvic floor. So this is the first step in learning how to stop pain with sex, stop leakage with exercise, is learning how to belly breathe, because now we're going to start to relax the muscles. This is like the easiest thing you can do at home on your own to start the process. Thank you, Maggie. Okay, was anyone able to switch it? Okay, it just took some like effort. Yeah, it's like, oh, this is really hard. So try it again sitting down now, see if that changes anything. I'll give you guys a couple minutes, not a couple minutes, but a couple breaths. Do you feel like it's easier or harder sitting?
It's easier.
What? A little bit harder.
I feel like it's harder to do this.
Really?
It's
Easier? I mean, it's different for everyone. It's an individual thing, but I think for majority of people it is easier sitting, just because like you're sitting and you can focus more on like what you're doing and like where you're focusing. So the next thing that I want you to do is, now that you've felt what belly breathing is, and now you know how to relax your pelvic floor, that's one way you can do it. Now, the other way you do it is by stretching the pelvic floor muscles. Oh, can you get me a pelvic wand? Thank you. Your boyfriend duty. So the
man, yeah.
So the other way you can stretch the pelvic floor to help teach it how to not be so tight all the time is using internal manual therapy. That's what I do as a pelvic floor physical therapist. I have patients that come to me and I'll do internal stretching to teach them how to relax their pelvic floor. Kind of like, has anyone ever been to PT for anything else? Okay. Kind of yell out, what did you go for?
ACL.
ACL.
Neck pain.
Pitch nerve.
Achilles tendon.
Okay, so a little all over the place. So did your PT, thanks. Did your PT ever do any hands-on stuff with you?
Yes.
Okay, like what?
Massage.
Cupping. Okay, massage. Grafton, yeah. Ooh, that's aggressive.
Dry
Feels
needling.
good. Dry needling, perfect. So all these things are the same techniques that you can use at the pelvic floor level. So just like how for like an ACL or like, if you're working your quad or your back muscles or your neck muscles, you would go there and they would do some hands-on work. That's what we do as pelvic therapists. We'll do internal treatments and also external treatments to treat the inner thighs, the glutes. People hold a lot of tension back here in the back of the trunk. So you gotta work on this area and the pelvic floor. So we actually, once my patients are more independent and they're starting to show a lot of improvement, I will teach them how to use, there's the bladder. I will teach them how to use a pelvic wand. So a pelvic wand is, have you guys seen those Theracane tools that you put on your back and you can kind of has the ball in the end? Yeah, they're pretty great. So this is like that, but for your vag. So you can take this tool and you can actually learn, and I teach people this all the time, how to actually target your own muscle tension and start to release the muscles on your own. So I'll teach people how to target all these teeny little guys. All that red is all of your pelvic floor muscles. And so this is how you can start to work on lengthening and relaxing your pelvic floor so that you can experience pain-free sex, leak-free workouts, and feel more empowered and knowledgeable about your body. So you're not questioning, what is it down here? And you're more confident. So, great question. Going back to your question about how to start to relax your pelvic floor. So after people have learned how to relax their pelvic floor and they don't have tension here, what we start to do is teaching how to start to use the muscles. So, there is a time and place for activating and squeezing down there. So going back to what is a kegel? A kegel is basically just squeezing these muscles down here. So I'm gonna have you guys stand up again because we're gonna start to use those muscles. Okay? So everyone take your hand and you're gonna find, you have two options. You can either go right here, right outside the labia, or you can go on your anus. Yeah, I said anus. Right. Put your hand literally right on it. Okay. I would say back here is easier. Yeah, it's easier. What
are we looking for?
Yeah.
Your anus. We're looking for the anus. Okay. So you are looking for this little guy right here. So you go on the back side and then find it right there. Everyone got it?
Yep.
Okay. So now what I want you to do is try to squeeze like you're trying to hold in gas or stop pee from coming out. Okay. Did you guys feel anything? What did you feel?
Pinched myself.
That's good. There. Anyone else feel anything? Did anyone not feel anything?
I barely.
Barely?
Yeah.
Okay.
I'm not sure if I'm just making it up that I'm feeling. I don't think I feel anything.
It's hard. It's really hard to feel these muscles working. But, you know, if your muscles are the right length, then you should feel it pretty clearly. If your muscles are kind of shortened and kind of tight, or if they're kind of weak, then you're not gonna like really feel it happen, okay? And that's one of the things that we work on in like pelvic PT. So okay, put your hand there again. We're not done. Okay, so now squeeze again, and then let it go. What do you guys feel?
Well, the contraction of
Yeah.
the muscle, like going in.
Release of gas.
You feel like going?
Yeah.
Okay, and then you feel it kind of drop too?
Mhm.
Like both? Okay. Does anyone not feel it kind of let go?
I got some problems.
Okay. It's okay. That's what we work on.
You're in the right place.
Yeah. So that's one of the things that you have to learn is you have to learn how to relax the muscle. You have to learn how to engage the muscle for it to work for you in your daily life. Okay. So, and also by learning how to contract it, you also keep the pain away. So if we work really hard to like stretch the muscles, I don't want you to go out in the world and then, because your pelvic floor is always working, like all of y'all's pelvic floor is like working right now.
It's keeping everything in.
Yeah, because you're standing and nothing's like actively coming out.
My bladder's
So all of your pelvic floors are working right now, and you don't even have to do a Kegel. They're just working on their own, you know? So I forgot where I was going with that. I'm just so excited right now. Yeah, so basically you have to have full range of motion of your pelvic floor for it to function well. And then the last thing that we're going to do is we're going to start using it actively, okay? So oh shoot, I'm so sorry. Can you go grab the balloons out of my bag?
Grab the what?
The balloons, all of them.
Just bring the whole bag.
So remember how I said how your pelvic floor is automatically working for you just standing here? You don't have to do anything. So this is how you can strengthen your pelvic floor without doing Kegels, is by using your deep core muscles. So specifically, your transverse abdominis is what we call it. But basically, it's the last muscle in your core. You got your six-pack, you know, right in the front. You have your obliques on the side, and then you have your transverse abdominis at the very bottom. And so I'm gonna get you guys a balloon to try it out.
Just pass the bag.
Yeah, just pass the bag around. Everyone grab a balloon. Grab a balloon. And once you get, don't blow up the balloon yet, once you get it. So by blowing up the balloon, I'm gonna check you guys to see if you're using the right muscle. And if you're using the right muscle, that means you're using your pelvic floor, okay? So this is how you can use it more functionally in daily life. So in a second, when everyone has a balloon, you're gonna start blowing up the balloon. And when you blow up the balloon, I want you guys to notice what you feel happening at your stomach, okay? So try to take a notice like what your stomach does when you blow up your balloon. So you can practice a few times. I'm gonna just walk around.
The muscle gets
Does it?
Yeah.
Okay. Try to keep on doing Okay, let it out and do it again. Okay, everyone let their balloon out. Okay, did anyone feel who felt their stomach like come out into their hand? You felt it kind of push out into your hand? Okay. Everyone, or one person that did come up here. Any volunteers? Okay. So can you do it again so I can watch it? Okay. Do you mind if I lift up? Okay. Perfect. Okay. Okay. Yep, you're right. So when you blew up the balloon, your stomach came out, right? So we want the opposite to happen, actually.
Oh.
should I stay? Yeah, I'm gonna stay up here.
Oh.
I'm gonna have you do it.
She's gonna fix it.
Yeah. So now we want the muscles to come in, and when they come in, because when your stomach goes out, what happens is, this is where Penny is gonna come into play.
Are you lengthening your pelvic floor?
So, yes, not really. So what happens is when you do like that and you stick your stomach out, what happens is the pressure goes down. So this is your pelvic floor. These are your abs. This is your diaphragm muscle, and when you push on your stomach, it puts a lot of like strain on your pelvic floor, and it can cause leakage. It can weaken the pelvic floor. It can then make it tight too by like weakening it. So what we want to do is we want this to come in, and when this comes in, this will go up in your pelvic floor. So now try it again and try to see if you can draw your belly button in towards your spine when you blow up the balloon. Yeah! Yeah! It's hard though, right? It's hard.
It is hard.
Did you feel it different?
I feel the difference.
Yeah.
Going in.
Right?
Yeah. So yeah, you felt everything kind of working more together versus like when you push out, you kind of feel pressure going to the pelvic floor. Careful. Thank you. Thank you. Okay. Anyone else who had the push out, try it again.
Yeah.
Okay.
Yeah.
Feel a difference? So that's how you can use your pelvic floor to work for you versus weakening it and straining it. Okay. So the three things that we've talked about is, one, we talked about how to relax the pelvic floor by using your diaphragm, because when you belly breathe, it helps to lengthen it, and then you can also do pelvic PT to help lengthen the muscles. And then, once your muscles are lengthened and they're ready, then you can start strengthening them when they're ready. And that's why kegels can sometimes make things worse, is because if you strengthen it before it's ready, then you end up with more problems. So then we work on strengthening. Yes?
Question. So, like when we're blowing up the balloon, we're using our abdominal muscles, which indirectly helps strengthen the pelvic.
So, yeah, so your deep abs, they co-contract with your pelvic floor.
Okay.
Yeah, it's
Does
like
that mean-
automatic.
When you say co-contract,
Yeah.
does that mean, what does that mean?
Okay.
At the same time.
I'm sorry, good question.
Simultaneously.
Yeah, simultaneously,
Okay.
they will engage together automatically. Some people don't do that though, so that's something I always check for during like pelvic floor exams. I see if the muscles are working together or are if they're out of sync.
So how do you know if you need to lengthen your pelvic floor before strengthening
For
it?
strengthening.
Yeah.
So usually I can tell that with an internal exam. So in pelvic floor therapy, we'll do like an internal, like intravaginal or intrarectal exam, and you can feel the muscles, and like I can tell if a muscle is tight. So everyone touch your knee bone. See how it feels hard, and then touch your quad up above it. See how it's soft. So when a pelvic floor is overly active, it'll feel harder versus like your quad, because it's muscle tissue, so it should be soft just like your other muscles are. So that's how like I can tell, and then I know which direction, what kind of treatment someone needs, and when they're ready for strengthening is when that's not happening anymore.
Got it.
Yeah, great question. So yeah, those were so first thing was relaxing your pelvic floor. Second thing was finding it and being able to feel. Remember when we touched your anus? That was pretty cool, right? And then lastly, you were able to use them together, and that's the last step. So step 1 is first awareness, step 2 is lengthening the pelvic floor, and step 3 is strengthening it. And those 3 things together is how you end up being able to experience pain-free sex again, and being able to experience leak-free jumping jack. Yes.
So now I'm having another thought, because
Yeah.
I'm connecting things, right?
Yes.
So, like when you use your abs, you're
Mhm.
also kind of unintentionally using your pelvic muscle as well.
Yes.
So, like if you're doing a lot of abs, that could theoretically lead to a tight pelvic floor.
Sometimes, like I was talking with someone earlier about Pilates, for example, and Pilates is great in a certain time, but sometimes like certain exercises can make your pelvic floor more overactive, which we don't really want. Doesn't mean you can't do it, it's just you have to learn how to you have to learn how to be in control of your muscles. And then once you can demonstrate control of your pelvic floor, then yeah, you can do like whatever you want to do. It's totally fine. But you do have to learn how to relax it first. Yeah.
What would you say is another exercise to activate, like, but without using a balloon? Just in case you don't have those around the house.
Yeah. You don't have to keep it with you all the time.
It's an idea. Oh, okay.
So one thing I'll teach people is like if you remember how you found your hip bones earlier, like up here. If you move your hand 1 inch in, right here, that's where you can feel the muscle. So if you take an inhale through your nose, remember we're belly breathing though, so no chest rising. And as you exhale, pretend like you're blowing out birthday candles. So you see me from the side view. I'm gonna like relax my stomach, and then if I inhale and then exhale, I'll feel, you can feel something pushing into your fingertips, you know? I know, isn't it cool? Yeah, and that's the muscle working. That's how you can double check yourself, is if you feel it, that means it's working. But remember, you don't wanna feel it like
Overactive.
yeah, you don't, like you shouldn't be sucking in. You don't wanna go like that. And you also don't wanna go like that. It's like, you're gonna see my stomach. So see how my stomach comes in, but what you feel is you feel it like pushing out. Yeah, it's
The muscle
really,
like bulging.
yeah, the muscle bulges, but when you look, you see your stomach coming in, and that's how you're using it correctly. Now, if you overdo kegels or overdo that exercise, and it starts to make your symptoms worse, that's another sign that you probably need to lengthen your pelvic floor first before you start to strengthen it. Yes.
So I do that like a lot with like strength training, and do you think that might be a reason why it's overactive?
It could be, yeah. And usually I find, I mean, I would never blame one thing on someone's symptoms.
Yeah.
I usually find it's like multiple things that we have to address in your life. And so that could be one contributing factor, but you also need to stabilize when you're weightlifting. So that's like very important to like keep your back safe and everything.
Yeah.
So again, it's learning how to like lengthen it, but then also like use it again. But yeah, maybe.
But strength training is so great.
Yes.
But it's like just getting that fixed first and then like coming back to it.
You can still
moderate.
do it. And, yeah, you can still do it while you're doing pelvic PT.
Okay.
Yeah, that's fine.
I'm gonna get
Okay.
I need you in my life.
I also have a question about like pregnancy and delivery and postpartum. Like,
Yeah.
when would you recommend and why?
Yeah. So I would
At
recommend
different stages.
Yeah. Oh yeah, y'all can sit down. I would recommend. So you're asking during pregnancy or
And beyond, like,
Beyond.
at what do you generally need?
yeah. So during pregnancy, for the first trimester and second trimester, a lot of it is strength building because usually during pregnancy people have a lot of like. Have you guys ever heard like, oh, well, you're pregnant, so like have back pain, right?
Or what to expect?
Sorry, we're over two.
No, Dr. Amy just needs to get her like
Oh, okay.
stuff out. Plus, we want to get a picture of them.
Oh yeah, okay, yeah. I'm gonna answer one more question, and then I'll answer that question, and then if anyone has any more questions, I'm gonna give you guys my phone number, and you can text me, and then we can have a phone if you want, because I'm never out of time. But for second trimester, strength building, because during pregnancy, there are a lot of muscle imbalances, and so we have to strengthen the muscles around the pelvis to prep and work on your stamina. Because like labor and delivery, that's a freaking marathon, you know? So like we work on that. And then once you hit 32, 34 weeks in your third trimester, we start working on lengthening the pelvic floor because your pelvic floor has got to get out of the way and relax so that you can push a baby out. So Kegels are not going to help you push a baby out. Your uterus pushes the baby out and your pelvic floor has to open and get out of the way. So most people are so tense that I have to teach them how to relax and lengthen the pelvic floor. Third trimester.
So essentially, the kegels could potentially hold the baby in.
Yes.
In more.
Yes.
Yeah.
Okay, everyone. To wrap up, take your phone out and then open up your text messages. Let me give you my phone number. Oh, you have my phone number already. Okay, so my phone number is 770-910-0255. 0684. And if you just want to talk on the phone about like whatever problems you're experiencing, just text me, say me. Actually, maybe put your name. Put me and then your name, and then I'll get back to you as soon as possible. But anyone that texts me, if you text me, I'm gonna put you in a raffle for a free pelvic wand. So you'll get one of these guys. So yeah. Any other questions? I'll answer on the phone with you guys. But thank you guys so much for coming to the first. Thank you. Okay, thank you guys so much. Does anyone want to take a picture with the? Does anyone want to wear this? Anyone want to wear this?
No,
Amy Newberry. Yeah. And I do have cards. I didn't bring them in here, but the cards are on my table out there.
I want to try it on.
Yeah, you want to try it on?
Yeah, I want to try it on.
I love it. I love it.
Oh my gosh, yes.
Thank you, Amy.
That
That
was
was really cool.
fun. That was great.
I want to introduce my husband.
Oh my
That's
gosh,
why-
yes.
no,
I was really hoping other people would wear it.
7684 for the last.
Can I get a picture of you?
06.
Yes, please.
Yeah.
Here, get out of the hole.
What's your name?
She invited me.
Okay.
Your phone? Stephanie's also here.
These are so delicious. This one is fantastic.
Oh shoot, what are you doing?
Just remind me of the
I don't know how to run it.
benefits of metal.
It's just nutritive. Yeah, minerals, iron, yeah, it's also ounces, but not, it's before it has done freeze dried. But so in this one, it's
Like somebody, y'all came to like my church one time and I was literally like thrown into like a spiral. It was just like too much. Yeah, so I'm grateful to be able to be in a group that I
Wow.
like listen to stuff.
That's amazing. You're in it. You're in the You want in?
Oh, I didn't realize it's off.
Yeah. Yeah.
I think they want you for a picture really bad.
I don't. I think it's gonna be. We should have done this together.
I know, I'm like thrilled.
Oh, I know, that's more metal. Which one did you go back for?
You should try some of this.
So I'm like,
Thank you again.
I know, right? I know.